Okay, so if you was here yesterday, you probably went through this question already. But I kind of want to break some things down because a lot of people had things to say and I was too tired to explain. So I'm going to do my best today. So this is a 50-year-old patient with history of liver cirrhosis. They're admitted with confusion, jaundice, and ascites. The lab result shows that serum level is 125 and the potassium is 5.5, right? What are the two most appropriate nursing interventions for this patient? A. Administer a loop diuretic as prescribed. B. Monitor for signs of hepatic encephalopathy. C. Encourage a no-sodium diet. D. Administer spironolactone as prescribed. E. Monitor signs for hyperkalemia. F. Encourage fluid restrictions. The two most appropriate nursing interventions for this patient. Patient with cirrhosis, right? They're confused, they have jaundice, they have ascites, their sodium is low, and their potassium is high. B and E, okay, so we're on the same page with this one, I guess. Okay, 30-year-old female is admitted to the ER following an MVA. She has lost a significant amount of blood and is presenting with tachycardia, hypotension, and decreased urine output. What is your priority nursing intervention for this patient? I'm so excited. Okay. Good. I saw that makes me happy is she's in shock. I love that. And this is why I always tell you, know your stuff. The minute you understand this patient is in shock, you know the priority nursing intervention for a patient in shock. And that would be your isotonic IV fluid. Let's see. Okay, 70-year-old male patient with history of CHF, admitted with dehydration, and sodium level is 150. What type of IV fluid would you administer to this patient? A. Hypertonic solution. B. Normal saline. C. Half normal saline. D. Lactated ringers. E. Dextrose 5%. So for a patient who is obviously dehydrated, or shall I say they also have high sodium, right? What solution would you administer to them? I kind of did a little thing to help you understand when and how to remember what solution to use. So if your patient is experiencing hypernatremia, so that means they have high sodium in their body, you will give that patient an hypotonic solution, right? So because it's gonna slowly reduce the amount of sodium in the body. Does that make sense? So when your patient has a high sodium level, you're gonna give hypotonic, which is also called half normal saline. Does that make sense? And if the patient is experiencing low sodium level, like the other patient that we had the other time, 115, you would give them an hypertonic solution because it's going to slowly increase the level of sodium within the body. And if your patient is dehydrated and the sodium level is within normal range, this is when you give normal saline. So for this question, definitely half normal saline, which is your hypotonic solution, is the correct answer. This is your rationale. A 65-year-old male patient with CKD is admitted with muscle weakness, fatigue, and irregular heartbeat, right? Potassium level is through the eye. What are the appropriate nursing intervention for this patient? Your options are A. Administer a potassium-sparing diuretic. B. Place the patient on cardiac monitor. C. Encourage a low potassium diet. D. Administer Electrolyte. E. Encourage high potassium foods. F. Monitor renal function. Again, the patient has chronic kidney disease. All right? They also have high sodium level. A is definitely not a contender because that's going to make their potassium level even worse. B, you want to definitely put them on cardiac monitor, right? C, you want to encourage a low potassium diet. D is Kehextolate. Does anybody know how Kehextolate works? Helps expel potassium through their not the diarrhea. Come on. So we do need that medication for sure. And E, obviously, we're not going to encourage an high potassium food because they already have high potassium, obviously. F, we want to monitor their renal function. For sure. We want to definitely monitor the renal function. So your answers are B, C, D, and F. Okay, question 20. 55-year-old female admitted with headache, nausea, and seizures. Lab level shows the serum level is 120. What is the priority nursing intervention for this patient? Select 2. Okay, so this patient is definitely having some headache, they have nausea, they have seizures, potassium level is 120. What are the 2 most important things that you will do for this patient? Number 1, would you give them an hypertonic solution? B, would you encourage high sodium diet? Would you place them on seizures precaution? Would you restrict fluid intake? Would you administer a loop diuretic? Would you encourage fluid intake? What are the 2 most important things that you would do? Better put them on seizures precaution. I'm rushing. If this is an hospital setting, the first thing I'm doing is seizures precaution, because you don't want them getting seizures when everything that you need in that scenario is not ready. You will hate yourself. 2 most correct answer, A and C. Question 21. 60-year-old male patient with history of lung cancer, right? They admitted with confusion, abdominal pain, and constipation. Lab results shows calcium of 12.5. What is your priority nursing intervention for this patient? Okay. A, administer a biphosphate medication. B, encourage high calcium diet. C, administer calcium supplement. D, encourage fluid intake. E, encourage a low calcium diet. This is pretty straightforward too. A, yes. Right answer is A. Moving on. A 50-year-old female patient with history of alcohol abuse is admitted with tremors, seizures, and positive trousseau sign. Lab results shows magnesium level of 1.2. What is the appropriate nursing intervention? Select or apply. Option 1, administer magnesium sulfate, right? This person clearly, okay, let's start. Do they have a high magnesium level or low? Good. So would you administer magnesium sulfate since they have a low magnesium level? Would you encourage food high in magnesium? Would you place the patient on seizures precautions? Would you monitor cardiac rhythm? Would you encourage them to cease alcohol? Remember the history, they have history of alcohol abuse. Would you encourage them and be like, hey sir, can we not do the alcohol for a little bit? Now I see. And this was a trap. Would you administer a calcium supplement? Why would you administer a calcium supplement? Nothing in this question gives you their calcium level. Because with nursing, you do not blindly do nothing. I don't care if your textbook says where magnesium goes, calcium goes. You don't randomly do anything or else it is indicated. Okay? And it's not prescribed, right? Let me pull up your ration. 70-year-old female patient with history of renal failure is admitted with shortness of breath. They have edema and they have hypertension. Lab results show sodium level of 138. What is the of this patient's symptoms? Okay, 24, 80-year-old female, male this time, with dementia is admitted with lethargy, weakness, and dry mucous membrane. I love this question. Lab results shows serum sodium level of 160. What are your priority nursing intervention for this patient? Select 2, just 2. Okay, so lethargic, the weak, they have dry mucous membrane. I'll tell you for free, they're dehydrated and they also have dementia. So those are the 2, just from this question, you can tell these are the 2 problems they have, right? Now, what are the 2 things you would do, obviously with high sodium? So what are the 2 things you do? A, would you administer an hypotonic solution? Hypo. Would you give them a high sodium diet? They already have high sodium anyway. Would you give them some more sodium? C, would you monitor them for signs of fluid overload as your priority? D, would you encourage fluid intake? E, would you administer a loop diuretic as prescribed? F, would you monitor mental status? Your priority nursing intervention. So your patient comes in, they have dehydration, they have dementia, they have high sodium. What are the 2 things you do first? You monitor. D, obviously encourage fluid intake because they're dehydrated, right? Hey, yes. D, thank you. So again, they have dementia. So even though their mental status is very important, this is a chronic disease for them. So this would be it wouldn't be priority over saying, hey, This 80-year-old patient, they have dementia. Let me get them a cup of water and encourage them to take this water. Hey, ma'am. Or is this sir? Hey, sir. I have this bottle of water. Would you like to take a sip? Let me pull up your rationale. Okay, 45-year-old female patient is admitted with thyroidectomy. I love this question because I really just want to know if your patient had a thyroidectomy, what are they at risk for? Hypo or hypocalcemia? Absolutely hypo. And they're experiencing numbness around the mouth and tingling in the finger. What would be your priority nursing intervention for this patient? Would you administer some calcium gluconate as prescribed? Would you encourage, again, priority, okay? Whenever you get a priority question, more than likely all your answer options could be correct. Or you could have like 3 most correct answers or 4 most correct answer options, right? But you have to determine which one is the most important, which one is priority, okay? So would you administer calcium gluconate? Would you encourage high calcium diet? Would you administer vitamin D? Would you place them on cardiac monitor? Or would you encourage fluid intake? Definitely A. You administer your calcium gluconate as prescribed. Let's go. I love it. I love it. Okay. 55-year-old male patient. They have history of CKD. They are admitted with decreased deep tendon reflexes. They have hypotension. They have respiratory depression. His lab result shows a serum magnesium level of 3.5. What is the most likely cause of this patient's symptoms? What is going on with this patient? Magnesium toxicity. Yay. Yes, Jay, you got it. You can't get it right. You can't get read. Let me read it. Due to CKD. Yeah. So that's exactly what my rationale. Actually, yeah, because of renal insufficiency, they can't get rid of their magnesium. You have a 22-year-old male admitted for severe burn covering 30% of his body. I love it. Oh, you guys are smart. Yay! Okay. Is experiencing tachycardia, hypertension, and decreased urine output. What are the appropriate nursing intervention? A, administer an hypertonic solution. B, administer an isotonic solution. C, monitor vital signs closely. D, encourage oral intake. E, administer pain medication as prescribed. F, monitor urine output. That's it. Here way. You want to really be careful with that. You don't want nothing by mouth, especially with 30% of his body. You know, we don't want to do that. The answers are B, C, E, and F. Okay, 45-year-old female, right, admitted with severe dehydration and serum sodium level of 125. What type of IV? I think we already had this question before. I think we did. Whenever you say a question with dehydration, check the sodium level to allow what type of solution to give. Because the first thing that comes to mind is he or she is dehydrated, right? I gotta give normal saline. But hold up, check the sodium level. If the question indicates anything regarding their sodium, either low or high, then use that piece of information to determine the type of solution you would give. Because you need to do 2 things with this question. Rehydrate the cell, drive the sodium level up. You got to rehydrate the cell, increase your sodium level. So lactated ringer is an isotonic solution, okay? So it's the same thing as normal saline. So remember, when you have low sodium level, you need hyper, right? If you have no sodium level in the body, you need an hypertonic solution. And if you have a high sodium level in the body, you need an hypo, which is also an half normal saline. So A is your correct answer. Gotcha. Okay. So your 65-year-old female patient is admitted with confusion, seizures, and serum sodium level of 115. What is the most likely cause of this patient's symptoms? A, dehydration. B, SIADH. C, hypernatremia. D, diabetes insipidus. E, hypokalemia. Someone said B or C. Why would you put B and C together? What cancels out C? Okay, low sodium cancels out C. What D? Diabetes insipidus. Would you have an high sodium with DI, or would you have an a low sodium with DI. Diabetes insipidus, would you be on high sodium or low sodium? High. Thank you. High sodium with DI. And then you get low sodium with the opposite of DI. What is that? SIADH. The answer is B. Okay, question 30. 40-year-old male patient with history of alcoholism is administered with tremors positive Sherbert stick. This word, Sherbert stick. What a positive Sherbert stick sign would look like. How do you test for it? You twitching of the face when tapped. Okay. So this patient has history of alcoholism and they have tremors. They are positive for Sherbert stick sign and their serum magnesium level is 1.0. What is your priority nursing intervention for this patient? A, would you administer magnesium sulfate to help them increase the magnesium level since they are obviously suffering from low magnesium? Would you encourage a food high in magnesium? Would you administer a calcium supplement? Would you encourage alcohol intake, and would you monitor their blood pressure? So we have an obvious problem here, and you guys know the magnesium level is 1.0. So if you have a patient and they have all of these signs and symptoms, what would you do? Yes, you do A. Okay, an 80-year-old male, right? They have history of CKD. They are breath, edema, so they definitely do have some fluid volume overload going on, but their sodium level is 135. Now, is this sodium level within normal range or not? I'll let you answer that. What are your appropriate nursing intervention for this patient? So the sodium level is within normal range, thank God, right? So would you administer a loop diuretic as prescribed? This patient obviously has some edema going on, they have shortness of breath, right? Would you, and the sodium is normal, but it's, it's bottom normal, right? So would you administer a loop diuretic to help them get rid of that fluid? Okay, we gotta get the fluid out somehow. B, would you encourage a low sodium diet, right? Would you tell them, sir, we're gonna have to go low on some salt, right? Because whatever salt goes, water go. Okay, would you monitor their vital signs closely? Would you do that? And would you encourage fluid intake? They already have a lot of fluid in their body anyway. Why are we encouraging fluid intake here? I don't think we need to do that. Would you place them in a high Fowler position, right? You guys know what that does for you. It expands your lung and it allows you to breathe better. Would you do that? And would you monitor their urine output? Like if you're gonna give somebody a loop diuretic to help them get their fluid out, would you want to monitor that fluid? Yes. So why are we skipping out on B? Why not B? Sodium is normal, but is this bottom normal? And remember, they're gonna get that loop diuretic, right? They're gonna get that loop diuretic, and that they're running risk of what? Right. So we can't skip out on B. Can't skip out on B. It's a low sodium diet. They won't completely be bland, right? But just low sodium diet. I'm gonna pull up your rationale, and then I'm gonna do regular general Q&A. Ask me any questions. What about the shortness of breath? The shortness of breath is because they have fluid volume overload. It's because they have fluid in their lungs, and whenever you give them that loop diuretic, it helps them get that fluid out, and they're able to breathe out, and they're able to breathe better. Also, when you place them on high Fowler's position, it helps them breathe better. I can't speak tonight. I swear to God, I cannot speak. Jesus. So also placing them on high Fowler's position will allow their lungs to expand and breathe better. All but D. Yes, ma'am. Tomorrow. Okay, let me do regular Q&A. Okay, I love you. I will see you in a few hours. Bye for now. Don't forget to grab your study guide.